My MIL won't shut up about my weight, so now I'm refusing to visit her. There is nothing easy about being a postpartum mom, and it can be particularly hard if you are a first-time mom who doesn't know what to expect. Having the support of a loving partner and family and friends can make such a huge difference to a new mom's mental health. Nothing is worse than people commenting judgmentally about new moms just trying to adjust to their new normal. Nasty comments from other moms can really feel like a dagger, especially when it comes from someone who is supposed to be part of your support system. A first-time mom posted in Reddit's AITA forum about her mother-in-law's complete lack of empathy after the mom gave birth. Not only is the woman a hands-off grandparent, but she also makes condescending remarks about the original poster's body. Things have gotten so bad that she doesn't even want to see this woman, and we can't say that we blame her. ARP's MIL is the passive-aggressive type. She's the kind who always has something to say but tends to dance around the issue. OP, who had the baby 5 months ago, explained that her MIL told her all about how she made losing the baby weight a priority when she had kids, and even commented about her granddaughter's chubby cheeks and how they resemble ARP's. But then she made a really mean comment. The final straw was when my husband was talking to her casually about my wanting to start going on runs again and how we were planning on making it work since our baby is very attached to me, OP explained. She very loudly said, "You're thinking about trying to run? Shouldn't you start with walking?" His whole family was in the room and looked at me waiting for my answer. I am an avid runner who only stopped due to my pregnancy, and her comment really hurt. OP also has a history of disordered eating. The MIL talked about ARP's body while knowing she suffered from an eating disorder as a teen. It's as if the woman has no filter or concern about the mother of her grandchild, and OP is done with it. She's decided to stop seeing her MIL completely. This is where I feel like the a-hole. I don't want to see her anymore. She makes me feel like crap about myself, and my husband is backing me up 100%, she wrote. His mom is angry because she thinks we are just keeping her grandchild away from her and believes it is unfair. He goes there without me, but it is difficult to take our baby because she is exclusively breastfed and refuses bottles of any kind. So, who's the a-hole here? Redditors think the ML needs to zip her lips. Redditors were not impressed and believe OP is totally justified in staying away. NTA, it is completely your choice to avoid someone who makes you feel bad about your body, one person wrote. Her intentions are not relevant, and it doesn't matter if her actions are small in the context of you having had and are managing your ED. She is being very selfish and inconsiderate. Another agreed, commenting, MIL can't say awful stuff and expect no consequences. My MIL said the most misogynistic, fat-shaming, etc. comments to me way before my daughter was born. She was completely shocked when I refused to ever even let her visit. "You don't like me, you don't get access to my kid." So did this person. There is a rule that goes disrespect the mother, never see the baby. She is likely to have other bad behavior if you don't nip this in the bud. Redditors appreciate ARP's husband's love for his wife. People thought he was doing the right thing by supporting his wife. Yes, MIL is his mother, and he can choose to see her if he wants, but OP has no obligation to her. It is great that your husband is not pushing you to visit his mother, but he should be very plain with her that you do not go because she is rude to you. Since you are nursing, that means that baby cannot go either, one person wrote. He needs to tell mom that he loves his wife and she needs to treat you with respect or she will be out of your lives. This person agreed, writing, "Glad your husband is backing you. That seems to so rarely happen in these cases. OP has no reason to see her MIL right now." Redditors overwhelmingly agree that ARP's MIL is the a-hole. This person had an amazingly petty response that we love. This is one of those rare justifiable petty moments. She lives 20 minutes away. She can come to you to see the little one. And the first time she makes anything close to a snarky comment about you, she can walk home again or be escorted out by a cop. I posted a list of things I won't let my 3 daughters do, and people think I'm way too strict. With each stage of parenting comes new challenges, and the tween and teen years can be particularly tricky to navigate. Establishing boundaries and enforcing rules can feel like an insurmountable task when kids continually push for independence. Parents are often faced with towing the line of allowing teens to spread their wings and ensuring they don't make life-altering mistakes. On April 23, 2024, Lottie Weaver took to TikTok with a video outlining 6 rules her daughters must follow. Her 3 girls are currently 4, 8, and 11, reports Newsweek. However, Lottie already knows how she's approaching things like dating, hanging out with friends, and smartphones. And the internet was divided about her strict philosophy. Lottie Weaver's first rule for her daughters had to do with dating. "We're not there yet. But I will not let my girls get in a car and go on a date with someone if I have not met them already," Lottie explained. "So they need to walk up to the door, knock, knock, 'Hi, my name is Joe, and I'm taking your daughter on a date.'" Rules number 2 and number 3 had to do with talking to strangers on the internet and having access to her kids' phones. Second on her list was talking to strangers on the internet, even if they are kids. You know, like the Roblox games, how you can message back and forth. No B, you will not be talking to any strangers," Lottie said. "And how will I know?" "Well, luckily, I'm a pretty observant parent. You know, check in on those babies. That's our job as parents, check in on our kids. Check their phones, okay? They may not want you to, but we check their phones. So you ain't messaging no strangers." Rule number 3 was that her daughters must give her the password to their phones. "I'm your parent," she said. "I can have access to your phone at any time." Lottie's other rules involved friends, school, and pets. You cannot be out with your friends all day, all night, all weekend, or whatever, Lottie explained for rule number 4. So if you go out all day on Saturday and you want to go out on Saturday night, you have to come home, spend an hour, say hello, check in, and then leave. Her 5th rule is that there will be no missing school assignments. "I don't necessarily care for the grades," she clarified. "Everything must be turned in." Finally, she has banned little animals from her home. No guinea pigs, no hamsters, no fishes, whatever, she stressed. "We've tried that before. It ended terribly. So when you move out, you can get all the animals you want." Many TikTok users thought the mom was way too strict. As of writing, Lottie's video has attracted more than 409,000 likes and over 3 million views. TikTok users sounded off in the comments, too, with many expressing disagreement over her parenting philosophy. One person wrote, "Strict parents make sneaky kids." Another TikTok user declared, "I'm gonna go hug my mom," while someone else snarked, "Why don't my kids visit me?" Yet another person wrote, "The phone one was crazy, that's my privacy." Meanwhile, someone else declared, "Well, aren't you just a bundle of joy?" Still, others felt her rules were completely reasonable. Not everyone criticized Lottie. One person shared, "These are all so valid tbh. My parents always had my password but never checked my phone BC they didn't have a reason to. I think regular checks are overbearing but knowing the password totally." Another TikTok user echoed, "My parents were exactly like this. This ain't strict, this is normal parenting to protect your kids. while someone else commented, "These aren't even that bad. They are so reasonable." Yet another person wrote, "All these kids in the comments are talking about strict. This isn't strict whatsoever. This is actually a normal parent, parenting and caring for her kids." Hating the journey, but loving the destination, a lesson in mothering. I am never doing this again. My husband made sympathetic noises over the phone as I retched into the bushes. I was supposed to be driving to work but had to pull over to throw up. Again. I was 24 weeks pregnant with my second child and it was not going well. The pregnancy had come as a surprise and was instantly stressful. Not only was it unexpected, I discovered I was pregnant while in the middle of passing a kidney stone. 0 out of 10 stars, don't recommend. Within a few days, the morning sickness kicked in and proceeded to fully kick my butt. Morning sickness, which had been unpleasant but manageable with my first pregnancy, became a menace. I was sick all the time in a way that all the Zofran in the world couldn't touch. In addition to the daily barfing, there were other delights in store for me on my second turn on the gestational roller coaster. I also had pregnancy-induced carpal tunnel syndrome, a challenge for someone who spends most of the day writing, pregnancy-induced sciatica, a cracked rib when I got a nasty upper respiratory virus that I couldn't shake, or take any good medicine for, because, super pregnant, and intermittent spotting that made me worry that I was going to lose the baby. On top of all that, I had an energetic 4-year-old to keep up with, an insanely busy job, and was dealing with one of the roughest rough patches in my normally stable marriage. I wouldn't say that I hated every single second of being pregnant. Just 99.9% of them. I think there was one Tuesday in there that was kind of okay, if I'm remembering correctly. Finding out that I was having a daughter was a bright spot, especially for my husband who had 4 brothers and 3 sons and had always wanted a girl. But most of the time, my second pregnancy really sucked. By the time I went into labor, I was exhausted, sore all over, and weighed almost 20 pounds less than I did when I got pregnant. Worst diet ever. I drove to the hospital honestly feeling more relieved that the pregnancy was going to be over soon than excited about meeting my daughter. And, man, did I feel guilty about that. I wanted to be someone who loved being pregnant. I wanted to be glowy and happy and in love with my bump. I mostly ended up feeling sweaty and miserable. I wanted to feel like my relationship with my daughter, who was certain to be my last baby because I was never doing this again, started in some magical way. I was worried that the difficulty of my pregnancy was some kind of harbinger that my relationship with my daughter wouldn't be as easy, as effortless, as it was when I fell instantly in love with my son. My son was kind of a perfect baby, the kind that makes first-time parents dangerously smug. The odds that I'd get 2 babies that came out fat and jolly, ready to sleep through the night at 5 weeks, seemed impossible. Was part of the overwhelming love I felt for my son based on the fact that he was just so easy? What if I couldn't love her as easily as I loved him? In a fitting end to my pregnancy, my delivery with my daughter was more eventful than expected. There was a tornado, and triplets being born down the hall, which meant all the nurses were even busier than usual, and a failed epidural. Hours after labor was finally over, I ended up having a significant hemorrhage, losing a lot of blood and thinking, for just a moment, oh, this is how women die in childbirth. But there was also this, her little hand grabbing my finger as she laid on my chest, the soft curls on the top of her perfect head, and the way she held her own head up, hours after birth, seeming determined to check this new place out. It turned out that I was right. She wasn't as easy of a baby as her brother was. Our first few months together sometimes made me feel like I was a first-time mom again. None of the tricks that worked on her brother seemed to work on her. Ironically, She looked almost exactly like him but seemed determined from day one to make sure we knew she was her own person. And not a bit of that made a difference when it came to losing my heart completely to her. I was in love with this baby from the first moment I saw her. That determined little baby just turned 12, and I am her favorite person. We sing Taylor Swift songs in the car and spend hours treading water in the deep end of the pool all summer long. She fills me in on the hot gossip from 6th grade and we listen to audiobooks of British murder mysteries while we paint together. She knows she has been loved every moment of her life. What I eventually learned from surviving, and never cherishing, my pregnancy with her, was a lesson that has served me well in other hard phases of parenting. Even when the journey sucks, you can still love the destination. Although I'm not in the baby phase anymore, I find that I think about that lesson a lot these days as I'm entering another period of parenting life when the journey isn't always easy. My son is a teenager now, and there are moments when parenting a teenager is not for the faint of heart. There are times when it is stressful and complicated and my list of worries is long. The stakes feel higher than ever. But I'm also getting to see this kid become a good man who cares about the world and wants to make it better. Even on the days when I'd rather opt out of having to give the same reminders about homework and picking up his stuff off the floor or look forward to not being an unpaid soccer chauffeur, I know that I'm going to love the man he is becoming, just like I loved the baby he was, just like I love his sister. I'm never going to cherish every moment, but the good news is that I also know, for certain, that I don't have to and I never did. Brittany Mahomes gets real about her kids' food allergies to help raise awareness. Parents want nothing more than to make sure their children are happy, healthy, and loved, which is why it can be so scary when your little one doesn't feel well. Brittany Mahomes, mom and food allergy advocate, knows that feeling all too well. Brittany and her husband Patrick Mahomes, the Kansas City Chiefs quarterback, have 2 young children, Sterling and Bronze, who both have severe food allergies. Brittany is sharing her family's experience to raise awareness about the signs of an allergic reaction in young children and how parents and caregivers can be prepared to confidently respond should an allergic emergency occur. Brittany's experience. We first learned of Sterling's food allergies after she was given formula for the first time. She was vomiting, sneezing, and had red eyes, Brittany says. This experience encouraged us to talk to our pediatrician and do early introduction of milk, eggs and peanuts with our youngest, Bronze. About 20 minutes after introducing a small amount of peanut powder to his bottle for the first time, Bronze started acting unusually tired and fussy. Brittany noticed he was irritable, but thought he was just tired and needed an early bedtime. Bronze was too young to describe what was happening, and his symptoms didn't look like Sterling's allergic reaction. When Bronze became inconsolable and started to break out into hives, Brittany rushed him to the emergency room, where doctors confirmed Bronze's allergy to peanuts. Based on my experience, Brittany says, I can tell you a severe allergic reaction may not look how you think it will, especially in babies and toddlers. Many parents are aware of what allergic reactions look like in adults: itching skin, swelling of the face, tingling or itching of the mouth, hives, but the symptoms for young children can look different. Babies and toddlers are more likely to have skin and stomach symptoms when they have allergic reactions. Both of my kids got really fussy and irritable, explains Brittany. With my daughter Sterling, the vomiting, sneezing, and red eyes were pretty heavy cues that something was wrong. And with Bronze, the hives and the welts quickly began to cover his body. Recognizing the signs and symptoms, Dr. Ruchi Gupta, professor of pediatrics and director of the Center for Food Allergy and Asthma Research at Northwestern University Feinberg School of Medicine and Lurie Children's Hospital of Chicago and paid medical advisor to Kaleo, explains that not only can signs of an allergic reaction be difficult to spot in infants and toddlers, Symptoms of a severe allergic reaction may vary by age and race. Some of the symptoms to watch out for include fussiness and spitting up, stomach-related issues, like persistent vomiting, and skin reactions, like hives. 1, 2, 3, 4. On lighter skin, hives appear as raised red bumps, while on darker skin, hives appear as raised bumps and color changes may not be as obvious. Make sure to talk to your child's doctor about what it could look like if your child has an allergic reaction to food. Responding to an allergic emergency. Knowing the signs and symptoms of a severe allergic reaction is the first step, but equally important is knowing how to respond in an allergic emergency. Being prepared includes having an anaphylaxis action plan, keeping 2 epinephrine auto-injectors, such as AUVIQ, epinephrine injection, USP, with your child, and educating caregivers, including at school or daycare, about reaction signs and symptoms and how to manage them, explains Dr. Gupta. After our kids' allergic reactions, our family's doctor prescribed them both AUVIQ, Brittany says. AUVIQ is the only FDA-approved epinephrine auto-injector for infants and toddlers weighing 16.5 to 33 pounds. What I love most about AUVIQ is the calm voice and clear instructions that can help parents and caregivers confidently administer epinephrine. It even reminds you to call 911. Making a game plan. Food allergy families should have a game plan to make sure they're prepared for an allergic emergency. Brittany explains, our family's food allergy game plan is important so that we can enjoy our time with Bronze and Sterling. Our game plan includes communicating the kids' allergies to those around us, staying prepared with snacks and foods our kids can safely eat, bringing extra snacks for sharing with their friends, and carrying our AUVIQ. Indication. AUVIQ, epinephrine injection, USP, is a prescription medicine used to treat life-threatening allergic reactions, including anaphylaxis, in people who are at risk for or have a history of serious allergic reactions. Important safety information. AUVIQ is for immediate self, or caregiver, administration and does not take the place of emergency medical care. Seek immediate medical treatment after using AUVIQ. Each AUVIQ contains a single dose of epinephrine. AUVIQ should only be injected into your outer thigh, through clothing if necessary. If you inject a young child or infant with AUVIQ, hold their leg firmly in place before and during the injection to prevent injuries. Do not inject AUVIQ into any other part of your body, such as into veins, buttocks, fingers, toes, hands, or feet. If this occurs, seek immediate medical treatment and make sure to inform the healthcare provider of the location of the accidental injection. Only a healthcare provider should give additional doses of epinephrine if more than 2 doses are necessary for a single allergic emergency. Rarely, patients who use AUVIQ may develop infections at the injection site within a few days of an injection. Some of these infections can be serious. Call your healthcare provider right away if you have any of the following symptoms at an injection site: redness that does not go away, swelling, tenderness, or the area feels warm to the touch. If you have certain medical conditions, or take certain medicines, your condition may get worse or you may have more or longer-lasting side effects when you use AUVIQ. Be sure to tell your healthcare provider about all the medicines you take, especially medicines for asthma. Also tell your healthcare provider about all of your medical conditions, especially if you have asthma, a history of depression, thyroid problems, Parkinson's disease, diabetes, heart problems, or high blood pressure, have any other medical conditions, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Epinephrine should be used with caution if you have heart disease or are taking certain medicines that can cause heart-related, cardiac, symptoms. Common side effects include fast, irregular or pounding heartbeat, sweating, shakiness, headache, paleness, feelings of overexcitement, nervousness, or anxiety, weakness, dizziness, nausea and vomiting, or breathing problems. These side effects usually go away quickly, especially if you rest. Tell your healthcare provider if you have any side effect that bothers you or that does not go away.